What's up, guys? Today's topic: how to fix your knee pain. Right? Today I'm gonna go a few things on what worked for me and how I fixed my patella tendonitis. It's pretty common. I had it through basketball. Obviously, it's a high impact sport. I'm gonna give you tips and tricks on how to get around it, what works, what doesn't, analgesic effects, isometrics, and if you have pain while doing exercises, what you should do, and all those. I have the subtopics link. I have the subtopics on the screen, and we'll go right into it. So, guys, for those of you who don't know, this is called the knee sit. It's pretty common. What it does is it lengthens the patella tendon, right? Lengthening, first of all, does not get rid of knee pain. It doesn't fix knee pain. It doesn't strengthen your knees. What it does is it gives an analgesic effect. It temporarily relieves the knee pain, okay? These are two exercises that you can start off with temporarily. Keep that in mind, okay? The knee sits and the knee bounces, right? These are two things that I started off with temporarily. What it does is it lengthens the tendon. Lengthening relieves the pain, doesn't strengthen it, okay? So these are some analgesic exercises. These are mainly for pain relief. I would not recommend doing these frequently once your pain's gone. Just at the beginning stages, when those pains in your knee, your patella are really spiking up, this is where you want to use them. Implement them daily. Maybe 100 is what I did for 100 reps of those knee bounces, and for the knee sit probably a minute. Yeah. And the next one's it's gonna be isometrics now. Alright guys, isometrics. Isometrics is the key. I'm telling you, I preach these. Isometrics is what fixed my knee pain for good. Okay? It really strengthens the tendon and the muscles around it. What this does is it allows your body to increase tendon stiffness, meaning it can absorb shock a lot more. Okay? This is very important, especially for athletes or if you're doing any sports. Even if you want to get back to jogging or running, this is the key. While it's strengthening, see here, as you can see, I'm doing with my hands. All the muscle fibers and stuff will start working around it, which is also a muscle workout. But for the tendons mainly, the wall sit is an excellent exercise. Another exercise you could do, a lunge, or single leg lunges. As you can see, I'm working at a 90-degree angle here because athletes and mainly basketball players, you're not really going to go below that 90-degree angle in the game. I don't think you ever see it. So strengthening it above that top 90 degrees, the top 90-degree half, is the main thing you want to do. As you can see here, you can also add an extra isometric by elevating the heel. You'll get your Achilles working on this as well. Alright guys, low level plyometrics. As we can see here, I'm doing pogos, two-legged. These are good for the Achilles, and this should be the first thing you're doing whilst trying to get back into jumping. You don't want to go high intensity, you don't want to jump or go try dunk or do some high layups and fancy stuff. It's not going to be good for you. Second up, the next progression for your knees mainly would be go deeper, okay? Well, going deeper is going to be more dominant, knee dominant. Not as deep, it's going to be less knee dominant, okay? You want to work on those extensive joints and tendons around the knee. As you can see, the shock absorbs them. Lastly guys, if you are feeling knee pain whilst doing isometrics, say this is your working range, this is what you want to work at, okay? Your pain shouldn't be above probably a 3 out of 10. Otherwise you need to back off a little bit like this. when you back off, you want to work on that area until it reduces. Okay. Once it reduces to around a 3 out of 10, then you can slowly go deeper and deeper. If your starting range is at the top, it's at the top. Okay. Don't push it. Slowly work your way down. It might take weeks, months, couple months. Okay. When you do this and slowly progress deeper, it will recover. Guys, the most important thing out of all of this you guys should take is don't rest it. I know, if you rest it and come back to it, it's going to hurt more. Don't rest it. Progressively overload the isometrics and you'll be fine. If you rest it, however, and then you try to go back doing these sports, it will not help. If you have rested it, the best thing to do is regain the strength in your joints and tendons by doing isometrics before doing sports. Don't rest it and then just jump back into jumping. It's not going to help. If you like this video, like and subscribe. Make sure to comment down below. And see you in the next one. Progression is single-legged.